everybody, it's Kiss and Tell Magazine, and welcome back to a new year with K&C. Today, we're talking about menopause because it needs to be talked about as much as possible. And on a little side note, we have a yearly conference every year, and this year it's about menopause. It will be in October. And Dr. Angela, who's sitting with me, is one of the speakers this year in October. So welcome.
Thank you. Thanks for having me.
Thank you. So I know, as you know, that menopause is huge right now. One, because there's not enough information about it. Two, there's more females in menopause than I think most can handle. I mean, in general, practices, physicians, um, so it's everything's just happening really quickly. So what do you happens? Introduce what you do to the viewers so they
Okay.
understand.
Okay, fine. So I'm a doctor, a medical doctor, was a family physician, family doctor, and have a background in cancer medicine. But I'm also a British Menopause Society accredited specialist in menopause. So I now do specialist work specifically with women that are going through menopause. But I'm also a clinical sexologist, so trained in sex therapy and sex medicine and menopause and sex. Have it's a rocky road for a lot of people. So I spend a lot of my week helping people to kind of navigate their way through that.
So do you feel like they easily talk to you about it, or is there still resistance to having the conversation?
It's interesting, actually. My experience is that people are quite comfortable, and I sometimes think, as a doctor, that we set the tone. You know, how we talk about it is often like how someone who sits in front of us can talk about it.
Right.
And in the UK, the conversation about menopause has been much more noisy in the last 2 or 3 years. So I think initially people had a lot of shyness about talking about it, but
Mm.
it's getting easier. I did a workshop today for people after cancer, and there was real awkwardness talking about vaginal atrophy,
Mm.
and starting that conversation. But usually, yeah, people are getting a bit easier, I think, at talking about it.
Yeah, so can you say what that is? I know what it is, but can
Yeah,
you?
yeah, yeah. I mean, I think it's, one of the major issues that people hit as they go into menopause, whether that's natural because it happens because their ovaries have exhausted egg supply, or whether it's brought on because we take the ovaries out or people have cancer treatment. But the loss of hormones leads to really significant changes in the tissues in the pelvis. It's not just the vagina and the vulva and the pleasure structures like the clitoris that get affected, it's also the bladder and the pelvic floor muscles. So there's all sorts of ways that can show itself, but a lot of women start getting more urine infections, start feeling that they're relatively numb or they don't respond like they did. They're getting a bit dry, it's a bit sore. And I think a lot of people struggle with that for a long time and don't say something. I think in the UK people recognize more that maybe that is menopause, but for a
Mm.
long time I think these things happened to women and they didn't have a clue what was causing it.
Do you feel like anybody can laugh about the subject? I mean, do you
Yeah.
have anybody joking about it, or is it always serious?
No, I think one on one, actually, and in the group today, there was quite a lot of sharing of how crap it is to find that suddenly you leak, or it takes ages to reach orgasm or whatever. I think there are people that meet it with humor, but I also think some people meet it with shame, or they start to pretend, they start faking it, they start trying to avoid having sex. So I do think people divide quite a lot on it. But
Mm.
yeah, some of the stuff that happens, I think you maybe do need a sense of humor about, because it's a pretty tricky phase.
Yeah, I mean, it's easier to deal with it if you can laugh about it.
Hmm.
But it is, like you said, it's a tricky thing, and it's different for everyone. You know, you can't lump us all in the same thing. Like
No, yeah,
all of us won't experience it the same way. You know, you'll have a room of people who will know, oh, that's happening to you, it's not happening to me.
yeah,
So
yeah.
it can be confusing in that way too. Um, and regrettably, you can get a disconnect even
Mm,
in the fact because you can't relate to that feeling. There's okay, I don't need to listen, even though you can still learn from what they're trying to say or share. So,
mm.
so
Yeah.
go
And I
ahead.
think it's like, I think it happens in the backdrop of the problems that people have with sex anyway. So I think there's studies that show if women are having a good sex life when they get to menopause, they're more likely to have a good sex life after their menopause. But for some people, I guess they've been struggling for years. They've never felt able to say, I need this touch, I need this position, this happens. And then what you might just have been coping with, like just about, suddenly I think it can become much more uncomfortable or much more painful. The negative consequences can be greater. And I think for a lot of women, that's the reason that they kind of go, actually, I've had enough or I need some help with this.
Do you have any stories to share that are humorous? What?
Do you know, I don't, it's interesting. Like I think a lot of women um work it out in their relationship and a lot of couples can laugh about it and will adapt what they're doing. There was a lady today who was talking about keeping creams and lubes and how kind of mechanical it's got, but the fact that they have a good attitude in their relationship about slapping on a bit of cream so that they can continue, I think makes it a lot easier for them.
Yeah.
But also, I think it's about if you were awkward to begin with, if you were embarrassed to begin with, if you felt shame to begin with, those things get magnified. If you're in a great relationship with good communication and you can laugh about the fact that you've been going at it for 10 minutes and there's no chance of orgasm and you can take that lightly, then
Mhm.
that's good. But
Right.
it's different, like you say, it's different for everyone. Every woman is different to start with, and so this hits differently for everyone.
Right. I mean, it makes sense not to, to realize that. However, do you find that people are more open during this time to learning about their body? Because they're in a situation where they kind of have to, you can't shove it aside. Or do you feel like they don't? What-
I mean, you made a really good point, which is, and I often say it, women, they're not a homogenous group. You're talking about 51% of the population, right? So, and this is a universal stage that women go through.
Right,
And I think it is a difficult stage for some. For some, it's a blessed relief. They've had periods that they've hated all their life. They've struggled with
right,
aspects of their, those years that they've hated. So it varies. But I think women, in my experience, the women I speak to are pretty good at having the language for what's going on, are quite up for trying new things. I was getting toys out today in the workshop that I was doing, and there was a lot of laughter, but it was a woman group. It was people
mhm,
that were in a fairly safe space and they could joke and laugh about what we were talking about. I think a lot of women do feel shame or embarrassment when they're sat with a partner. They feel like maybe they're not as good as they should be or they're lacking. So I do think it's different with different people.
yeah, and communicating that. I mean, correct me if I'm wrong. I'm going to make a statement that is UK related, and I'm probably totally wrong. But from my impression, and correct me if I'm wrong, is UK is not known for communication, like easily communicating. I don't know
No.
if that's changed through the generations.
No,
So,
I think you're right. I think we're quite reserved. I think we're very British about sex, so people
uh,
laugh about it. There's this whole, if you look at the newspapers, if you look online, there's this whole like light conversation about sex and everybody
mhm,
jokes about it, but nobody talks about the sex that they're having in
uh,
any serious way. I don't think we're necessarily that great about asking for what we need or saying what we think. There's a lot of a lot of sarcasm and not saying things quite straight out. So, yeah, maybe there is a different way of approaching stuff than there might be in different countries.
Yeah. Well, I'm not saying we're any better. I mean,
Yeah.
I mean, we're very conservative in our thinking, and especially lately with the way,
Mm,
things have been censored and so forth. So, that contributes to the problem,
yeah.
having the conversation easily.
Yeah. We don't teach people the words. I mean, like, I don't know
Right.
what sex education's like for you guys, but for us, even now I've got children and I ask them, what are you being taught? And the conversation has a little bit about pleasure in there, but most of it is don't do this, don't do that, don't get an infection, don't get
Right.
pregnant.
Right.
Here are the consequences, the negative things. It's not a lot about, enthusiastic consent. There's not a lot about how to communicate with a partner or that sex might be recreation. It might be something we do just for the joy of it rather than, so I think we douse girls in that stuff and then we show them lots of images but don't really give them the language. So I don't think many people talk honestly about their experience of it, especially when it goes wrong. I think we talk about it easily when it's good, but we
Mhm.
don't talk about it easily as easily when it's difficult.
Right. We'll educate on that part, at least from academia, like K through
Mm,
12. Um,
mm,
I mean, college, you might get more information, depending on where you're going.
yeah,
But even still, one class is not enough, you know.
no.
So,
And we change, and like I say a lot of the time, female bodies, they're in flux the whole way through. You go on a contraceptive pill, your response might change. You get pregnant, your response might change. You have a baby, all these stages. And that's not thinking about, if you have a bereavement, if you have a relationship breakdown. So I think we don't equip people with the concept that it might change, that if it does change, go back to basics, figure yourself out first. What feels good, what feels bad, we don't talk easily about solo sex. We don't normalize that that's something that is good. So
mhm,
there's all those hurdles. And then when you hit menopause and suddenly your body's working very differently, I'm having to have these conversations with people who may never have engaged in like solo sex and explored their own body. And that's the nice bit of the work, isn't it? Because you're almost saying, look, there's a different way that this can be.
mhm.
But also people are sat there going, but when I was a kid, I was told this and I was shamed about that. So yeah, it's um it's a really complicated subject for some people.
Yeah, it is. And it's good that you mentioned solo sex, solo yourself, getting to know yourself and your body. I mean, and reminding yourself your body changes, as you said,
Mm,
with different things that you went through, having kids, menopause, it changes.
mm, mm.
And your needs change. What you wanted in your 20s, not necessarily what you want in your 30s and then, after that. So, and it's okay to change, but it's learning what your changes are too. And most people don't learn that. But regardless that you haven't learned it, let's say, we're lumping everybody into you haven't learned. Uh, From that perspective, let's say you haven't, you still can learn.
Yeah,
It's never too late to learn what you like and don't like in and out of the bedroom, how you like to be touched.
yeah, yeah.
So, and people think, well, I'm too old because I can't reproduce. I shouldn't focus on that part of my needs. But that you're just selling yourself short because that's one of the best things that a human body does is
Yep.
the pleasure part of being touched and, connecting to someone.
Yeah, and I think I was having this conversation with a colleague the other day saying I think that's the thing, isn't it? Because for some people, sex has always been about pleasure, it's been about reward. And then I think there's a set of people that experience it as a something that's needed within a relationship that they sometimes have to do when they're not really bothered. And, so they kind of they do the maintenance sex, or they have the sex that they're not that engaged in. And they get really used to not asking and going through the motions, and like not being honest about whether that was pleasurable or not. Or I get a lot of women that think that their bodies are awkward because they need more time or more touch or more. And I don't even like the phrase foreplay. I think it's all kind of sex. It's not just, penetration and the stuff you do that's not penetration. But even, I suppose, just broadening people's ideas that it doesn't have to be starter, main course, dessert, everybody gets a pudding. Actually, you can sometimes snack here, you can sometimes have everything because you want to, but sometimes you just want a breadstick,
Right.
and freeing that up takes the pressure away. I only want a little bit. That's all I want tonight is a little bit, and that should be allowed.
Now, I like how you put food into it.
Yeah, food's always a good analogy. I say it a lot with libido. Loads of people with desire and libido. I'm like, look, how many times do you eat because you're hungry? How often do you eat because someone brings the cheesecake in and you
Right.
didn't know you were hungry, then you smell it and you remember and you. And I think that happens at menopause. I think it's like you're used to running on, I don't know, you might have different language for it, but petrol and diesel is what I would say in the UK. It's like you've run one way with your hormones, sometimes leading your interest. And that
Mhm.
might have been how you got over distractions. And in the middle of the month, you did kind of feel your own desire. Now it might be a bit different, but you've got to create situations where you're going to see the cheesecake. You've got to actually create scenarios where you let yourself be tempted. And then they've got to think about your willingness for that. And if you're not willing for that, it's like, what's that about? Are you resentful? Are you tired? Are you strung out? Are you caring for everyone else?
Mhm.
Do you always get some negative thing happening, like an infection, and deal with that?
Right. Right. Are you in the moment or not? I mean, or you can have the cheesecake afterwards. You can,
Mm, yeah, yeah.
I mean, it's all, I mean, that we can have cheesecake while you guys are being intimate, feeding
Hmm.
each other. I mean, food is a great way of, like you just said, describing it. If you don't want to say your body parts, you can
Yeah,
say equate it to food. So when I'm eating chicken, I really don't like chicken, and then translate it into, you know,
yeah.
your body.
I
So
find it amazing how easy it is for us to negotiate going out for dinner with a partner and sitting over, which takeout are we going to get tonight? Well, I want to do this, I want to do that. And it can feel really awkward for couples to talk about it with sex. It's like, why is this area so much harder to negotiate for some people? But it definitely, yeah, it's about finding your language.
yeah, it is, and learning what you need,
Yeah.
and what your partner needs, and don't, that's important too, you know. But and then learning also reminding yourself and your partner that you two, in a relationship, so obviously you two matter to each other.
Mm, mm,
So, why not do the enhanced part of connecting, with pleasure? So,
mm.
so yes, thank you for that. So, do you have anything else that you want to add?
I mean, I think there is something about understanding your choices because you talked about the fact that some people really notice the changes, other people don't. And there's some research that suggests that there's some reasons for that, that maybe some of us have receptors that are more sensitive to our hormones, some of us maybe have receptors that are less sensitive. And I don't know what the picture is like for you in the US, but certainly for us, access to hormone therapies, access to vaginal hormones, it's still only maybe 15% of women that have access to hormone therapy. And we've been at this for a few years, that they're trying to do something about this. So I think it's worth saying that for some people, that conversation is worth having. And actually, having the hormones on board can make a big difference to controlling your symptoms so you don't feel tired, you can sleep, you're not sweating every time somebody gives you a kiss or you get slightly aroused.
Right.
And the vaginal hormones can be a real game changer in terms of lubricating the tissues, still feeling like they're sensitive, not getting infections afterwards. So I think if you're struggling and you've noticed that your body just doesn't do what it did before, or you're bothered by symptoms, understanding that you can do something about that is really important. And if you can't have hormones, there are other non-hormonal things that you can use that can make a difference.
Do people easily communicate what they're doing? The non-hormonal? Like,
Yeah, I mean, so there are non-hormonal drugs that we prescribe in menopause care. So there's like antidepressants and the pregabalin, gabapentin, that kind of stuff. But actually, I get everyone to look after their vulva like it's a cashmere jumper. I'm like, you can't just wash it in any old thing anymore. You've got to look after it. It needs a bit of care. And so I tend to get people to use really plain things like oils. I'm quite keen to get people to use something simple like coconut oil or sweet almond oil on the outside,
mhm,
wash with that, using moisturize, massage, and then I get them using vaginal moisturizers inside and lubes and finding the lubes that suit you. There's all sorts of different lubes, as you'll know, and
yeah,
you've got to work out what you need and what you like and what you feel comfortable using. I get loads of lube given to me at the conferences that I go to, so I feel like I have masses of stuff knocking around the house that we can. I was saying today, I remember when my kids smashing a bottle of lube in front of our refrigerator, and it took about a month to stop slipping. So some of these things are really, really good and really, really slippery.
yeah.
But you've got to find what works for you. But you're probably going to need it. I think the wetter the better, often with sex, and it doesn't always happen naturally post menopause.
Right, right. Yeah, that it helps when you
Yeah.
have to worry about hurting yourself.
Yeah, yeah, absolutely.
Yeah. And it helps your partner because they don't want to think that they're hurting you either. So,
Yeah, and I think for some people that's really that is difficult, right? Because what for a lot of people, realizing how wet your partner is a sign that they're desiring you. So it's kind of difficult, I think, for some people to transition and get used to the idea that their brain might be turned on, but their body isn't doing what it did, and their partner might not be getting the signals. So sometimes what I do is you help people with the language, or some of my patients will make sure that they have lubricant on board if they're thinking about sex, so the first touch is slippery and they
mhm.
don't feel embarrassed about that. Better chance of getting pleasure and getting some of their own lubrication if it starts with a bit of wetness. So there's all sorts of different ways you can approach it.
Yeah, and back to that communication because your body has changed and just
Mm,
because it's not naturally getting wet does not mean you don't desire what's happening. It's
yeah.
just your body doesn't do that like it used to.
And reminding women, those that are in heterosexual relationships, that they are not the only ones whose bodies are changing. I think women tend, because we all go through this at roughly the same life stage, we
Right,
can feel like we have an expiry date, but actually we know that, men's sexual function changes too, their sensitivity, their ability to climax, to go again, to get an
right,
erection. It's not
right,
just us. And I think that's important to remember. This is an aging thing, it's a human thing.
right, right. It's not one-sided.
Yeah, exactly.
Well, thank you for today, and everybody, if you want to talk to Dr. Angela in October, she'll be in the conference and you can actually ask her questions, but you have to attend to do that. So, but thank you for today.
It's a
Thank you,
pleasure.
everybody.